think I was super hyper aware of everybody else because I was so happy that I got a job and it was like, okay, I'm like making moves to living in New York and becoming a superstar. So I was like super happy and I saw that everybody else was like in distress and, looked like they had a lot that was going on in their minds. So I was like, maybe one day I'm going to come out here with a sign that says, "What's on your mind?" And then I did that. And then it really just spiraled into something even greater than I had thought it would be. And I really became within Harlem as well as Roxbury and Boston, really became a resource and an outlet for people to really just, talk, have a conversation, vent, have someone listen to them. And that's what started it. Got aboard along the way. People really gravitated towards what I wanted to do, wanted to support, and became a 501c3.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 65. Hey everyone, Omari Richards here. Thank you all so much for joining me once again for another great public health story today. Housekeeping items, make sure that you subscribe and you leave a review. Those two things greatly help the show get out to more people, help more public health people find out about the show, and just get help in navigating their public health journey. So I'll greatly appreciate that. Definitely share it with a friend, leave a like. You can leave a comment if you're watching this on YouTube, and just be sure to subscribe. And you can follow me on Instagram too at the PH Millennial. And if you want to support the show, you can go to buymeacoffee.com/the PH Millennial. I really enjoyed this episode. This guest has a nonprofit. She has a job and she recently started a for-profit consultancy. So I think a lot of great insights, and she shares a lot of great insights on her journey into public health. And just a little fun fact, she was an aspiring rapper at some point in time, which I thought is interesting. I think it is interesting. And I hope you all enjoy this episode and all the insights that come with it. Enjoy. Today, we have a passionate public health professional working to ameliorate health inequities in marginalized communities. She has a Bachelor's of Science in Public Health from the University of Massachusetts, Amherst. She then went on to get her Master of Public Health at the University of Miami, Leonard M. Miller School of Medicine. She's currently a Community Partners and Health Equity Program Manager at Steward Health Care Network. She's also the founder and executive director of What's on Your Mind, Inc., where they are combating the stigma of mental health illness in the communities of color by engaging in conversations around thoughts, emotions, and feelings. We have Theresa Alphonse, MPH. Welcome to the show.
Oh, thank you. That was quite the intro. It made me feel super accomplished. I appreciate that.
Well, I hope that you do feel accomplished, and I do think you're accomplished, and I'm excited to get to dig more into your story today.
Thank you.
Yeah, my pleasure, my pleasure. So how have you been doing? How you been coping during these times?
I've been good. I think it's really interesting that we're still in these times. I think I started the summer really thinking like it was going to be a hot girl summer for me and just my friends. And I mean, it has been to an extent. Um, and, just having been someone that was vaccinated since late winter, early spring, I thought I would be in a more hopeful place than I have been at this time. And I'll get into just, what I do, as we go along in the conversation. But a part of my role currently working for an international hospital system is looking at how we support getting our Medicaid patients in Massachusetts vaccinated. And, right now we're hitting that wall of, hard nose and the wait and sees and hoping to convert the wait and sees at this point. But yeah, I guess that's a long way of saying that I am, I'm thriving, not just surviving, and still trying to adapt to like the ever-changing new reality that COVID has brought to us.
Okay. Well, I'm glad that you're thriving. You got to have some of your hot girl summer still, and that, well, it seems like work has been really tough. And I do agree with you. Like, I thought that we would have more people vaccinated by now, which would have helped slow down the variants spreading and everything like that. But here we are today, and I guess we'll get into more of how you're trying to get those patients completed, I should say. I don't know if that's the right way to say it. Yeah. So tell me, how do you identify, and then tell us a little bit about your personal background?
So racially, I identify as Black, if that's what you're asking. Ethnically, I identify as Haitian-American. I like to introduce myself as both because I think it's a very specific duality. I'm not all the way Haitian and I'm not all the way American. And then in terms of my personal pronouns, I use the she series pronoun, so she, her, hers. And I guess a part of, my identity, I'm thinking about like the wheel of intersectionality. So there are so many ways I can, describe how I identify. But I think in terms of profession, I'm a public health professional. That's why I'm here.
Yes, it is indeed why you are here. And tell me a little bit more about like identifying as Haitian American and what that's meant for you.
Yeah, so my parents immigrated to the US, both of them in their late 20s. So I definitely grew up in a very Caribbean household. Although my parents did, for their personal reasons, spoke English to me. My grandparents only speak Haitian Creole, so I grew up spending lots of times at my grandparents' house, mostly my grandmother's, with a whole bunch of cousins, which I think a lot of people in our culture can relate to, and really just trying so ever passionately to be able to communicate with, the matriarchs of my family. I learned Creole, grew up eating Haitian food, and I think within Haitian culture specifically, a lot of our parents immigrate to the United States because of just the political climate within the country. They immigrate for more opportunity, and so a lot of times, a lot of Haitian Americans in the U.S. aren't able to go back to Haiti because of the environment. But fortunately, I've been to Haiti, multiple times throughout my lifetime. And then as, I got into adulthood and was able to afford plane tickets on my own, I started doing internships in Haiti, and I worked with Partners in Health. Their Haitian kind of arm called translated, it's called Zami La Sante. And I worked there a year after the earthquake. And during my time there, it actually looked like the earthquake happened an hour before my plane landed. And I worked alongside medical students, doctors, in some of the tent clinics. And I think that was kind of the solidifying factor in me thinking, maybe medical school is not for me. Maybe I don't want to be a doctor. I think a lot of what I saw made me squeamish, but that experience definitely strengthened my value of public health and thinking about like how do I support this entire population versus seeing people rotate into that clinic for like not even 5 minutes and then it's on to the next person. But yeah, I'm super passionate about being Haitian and I love my culture. And it's a huge part of how I navigate and see the world and even experience my profession. And, I'm so grateful that being in Massachusetts, we do have a large Haitian community. So I've been able to give back to not only the community of Haitian people in Haiti, but also throughout Massachusetts, as well as Florida, which I have some ties to as well.
Okay, awesome. That was a lot, and I love that it all tied back to like your public health journey and like what you wanted to do in public health. So you said you worked for the Haitian arm of Partners in Health. Was that before your bachelor's, or was that throughout your journey?
Yeah, that was while I was getting my bachelor's degree at
Okay.
UMass.
Well, hold up on that. I will ask you about that in a second then.
Okay.
But and where in the US did you grow up?
I grew up in Massachusetts.
Okay, so you're from okay, awesome. So before we get into all of those questions, what does public health mean to you?
Public health means looking at the population as a whole. It means thinking about what interventions are for the greater good of multiple people, of populations versus just looking at the individual. Public health is an intersection of so many sectors. Public health is education, public health is policy, public health is socioeconomics. So that's how I identify public health.
Okay, I like that. And yeah, broad definition definitely helps.
Public health is literally everything.
I know it's crazy because like you don't know about public health, but then when you learn about public health, you're like, oh, this is literally everything that is going on. It's interesting that we don't know more about the term public health when we're younger and stuff like that. But
Right.
that's neither here nor there. So you got your Bachelors of Science at the University of Massachusetts Amherst. So tell me the thought process for this. And this was also in public health. So did you start off as a public health major as well?
So no, I didn't. I started off as a biology major. I think like most people of Caribbean descent, I was, fed the idea that either you're a doctor, a nurse, a lawyer, and sometimes teacher was thrown in there, but not so much, not for me at least. And my parents really fed like the love of science in me. And, I did science camps and, did talented and gifted classes where they focused a lot on STEM. So I thought naturally, let me be a bio major, pre-med, and then I'll go to med school and then I'll become an OBGYN. And then once I got to undergrad, was taking biology 100 and 101 and Chem 100 and Chem 101. And I'm like, I don't think I can do this for like another 10 years. I don't think this is for me. And after talking to my advisor, I discovered, what public health was, because like you were saying, that was not a term that I had even, ever really heard of. And very early on in my undergraduate career, I made the switch. I think it was even within my freshman year that I was like, I don't think I want to do this anymore. And I made the switch to public health.
Okay, awesome. Well, I'm glad that advisor advised you to go into public health. We dearly appreciate it a lot. I want to say the episode that was released today, someone's advisor or like the registrar at their school pushed them into public health, which is, I think, very interesting, but I'm always happy for it. So during your bachelor's, you were a campus coordinator at the University of Massachusetts Amherst, UMass Amherst. So tell me about how do you get that and then what do you do in it?
Yeah, so I became the campus coordinator through an organization called Haitian-American Student Association. And a part of that organization, or we called it RSO, it was Resident Student Organization, I believe is the acronym. I don't know, I graduated a long time ago. But so what like my title and task was really thinking about how we can not only integrate Haitian culture on the campus of UMass Amherst, but how do we make the bridge between UMass Amherst, the Haitian students at UMass Amherst, and people in Haiti? Like, how do we connect the diaspora to those that are living there? So I worked really hard for 2 years to coordinate a service trip to Haiti. And the reason it took that long is because, I spoke a little bit about just the kind of political turmoil that Haiti is presently in and has been for decades. So it was very difficult to allow the school to approve travel to Haiti, because I think at the time, it was in red zone for travel restrictions. So I worked with our international travel organization office at the campus, worked with campus administrators, worked with our advisors, and then also people that were a part of the Haitian-American Student Association to figure out what exactly we were going to do in Haiti, who we were going to partner with when we got to Haiti, where we were going to stay, like figuring out all those logistics, raising money for that trip. And then eventually, my senior year, I was able to get that off the ground as the first inaugural trip to Haiti. And it was honestly amazing. And I really owe that experience. I attribute that experience to a lot of the jobs that I was able to get thereafter, because not having actual like work experience, I was really able to lean on that experience. And being 21, 22, a lot of employers were impressed that I had organized this trip for 5 students and 2 faculty that had never been done before, and had very much been a success. And since then, UMass Amherst has gone every year. Obviously, that pause, there has been a pause due to COVID, but was definitely a trailblazer in the sense of getting that trip off the ground and making those more strengthened ties between Haiti and the university.
Okay, that is dope, and I think I could definitely see why they viewed it as a very valuable experience. You said that you worked in it for 2 years. That's
Yeah.
some pretty serious dedication, and you said you named a lot of different like stakeholders that had to be convinced, as well as probably a lot of just lifting of heavy, well, not heavy things, but like metaphorically speaking.
Mhm.
So you said that you had to figure out the project and the partners that you were going to partner with in Haiti. So who were the partners, and then what was the project in the end for the inaugural trip?
Yeah, so we ended up partnering with a university called the University of the Nouvelle Grandance. And it is primarily an agricultural university, also with majors in business, as well as some other majors. And what we really did was try to have, create some sort of like needs assessment to figure out what it is that we can support them with. What do we have access to outside of really just like monetary things? Because I think we wanted to think about support in a sustainable way, as well as thinking about opportunities that would also be mutually beneficial. So it was a lot of like dialogue and team building, and also doing service together. So we had prepared a dinner for some orphanage children and played with those children together and brought them just like toothpaste and toothbrushes and soap and things like that. And then we got the opportunity to meet with the president of the Senate in Haiti at that time. My uncle works in politics in Haiti, so I was able to make some connections. It was so funny because all the students that went, they were calling me like the Beyonce of Haiti because they were like, "Oh, you're so connected," and I'm like, I try. But what we came as like an outcome of that needs assessment in that first trip was even just being able to provide students with access to like all of the like research databases that we had access to being students was super valuable. Talked about just like having laptops, computers, printers. um, they talked about like one of the issues, and it like really made us reflect and think about our education in the United States and things that we take for granted. And they talked about how a lot of their professors were like on volunteer basis. So like they would have professors fly out from like France or other parts of the Caribbean or the United States and only teach for 3 months and then be out and then like never come back again. So was just thinking about the accessibility that we have on campus and thinking about how we could even plug in. One of the things that we all talked about was like, once we were able to get our masters, how can we support and even like creating our own curriculums to be able to support. And that was something that we had been talking about, but again, I think COVID had put a wrench in that. But so that trip was I graduated in 2013. And, I was recently talking to the director about a couple years ago at this point about now that I have my master's, what kinds of, you know, classes could I teach? Because at the collegiate level in Haiti, you only need a master's to teach. It's not required to have a PhD, but COVID happened. And also, unfortunately, the director passed away from COVID a few months ago. So yeah, but all these long way answers of but yeah, so that was the trip, and it was again a really great experience.
Okay, that's awesome. That's awesome that you're able to do that. Like that's pretty huge, I would say, in my opinion. And then you were also talking about before about the other position that you had in your undergrad with Partners in Health, the Haitian branch, Zanmi Sante. Did I say that correctly?
Yeah, you
Awesome,
did really
awesome,
well.
awesome. Well, my Haitian friends aren't going to get on me for that. Thank you. So tell me a little bit more about how you got involved in this, and then what do you do?
Yeah, so I think like for the professionals listening, like we hear it all the time and it sounds so cliche, but like your network is your net worth. And that was like simply because I had told a family friend, this is what I'm studying, this is what I'm interested in. And, specifically at the time, I was super into, and I still am, but really wanted to expand my experience in global health in particular. And I've read a couple of Paul Farmer's books, particularly, around the work that he's done in Haiti. And I just thought to myself, I want to tap into Partners in Health in some way. And I definitely want to get, some international experience. And when you talk to people and you put your desires out there, people begin to connect the dots for you. So my family friend actually had a friend who was the medical director of Zomi La Sante. And, he kind of took me underneath his wing. And again, at the time, I was also thinking about how do I prepare myself for my medical school applications. So I thought, that would be a great experience and a great look. And that's how that connection was made. It wasn't like an internship that I applied for and was already, created or established. It was literally an internship that was created for me because I had approached this person and asked if I could intern with him.
Okay, that's awesome. That's awesome. And I'm definitely getting that more of that Beyonce of Haiti feel, So tell me more about like what you did, and then what was that moment that made you decide that you didn't want to go into medicine, or did it just like solidify that for you?
Yeah, so that experience was, very interesting, and it was definitely a learning experience. I attended lectures, of medical students. So Partners in Health at the time um, was building a hospital. So I was able to go and, look at the hospital and meet with the medical students that were supposed to go through a tract program to be able to become physicians at the hospital. So was able to kind of just observe that, did some administrative work as much as I could because, things were in Creole in their Partners in Health or Zami La Sante office within the capital. Again, it was also at the time, well, a year after the earthquake. So a lot of what I did was surrounding that as well. So they had set up a temporary clinic at Jean-Marie Parc François, which was like the biggest displacement tent city within the entire country. And the capital was hit the hardest by the earthquake, and the capital is the majority of the population of Haiti. So a lot of people in that tech clinic, and I would go every day for a certain amount of time. Sometimes it changed because it was Caribbean time. So every time they picked me up, it was probably like 2, 3 hours later than they said they would, but I digressed. So I would go and really just sit there and observe and, watch not only the medical students, but the actual physicians, like have people come in front of them, speak to them, diagnose them, write them a prescription or give them medicine on the spot or take them into another clinic to diagnose maybe a hernia, or, I saw burns, just saw so many different just crazy things related to the earthquake, unrelated to the earthquake, and just was able to not only work with those medical providers, but even just befriend people within the tent clinics, and, play with the children. Got to see a lot of different parts of the country because they also had different offices in different areas. So, yeah, just really mingling with medical students, providers, and watching them do their thing.
Okay, awesome. Well, I'm glad that you got to get that experience in. And it definitely is a sad time. And I know like the Caribbean in general, but Haiti especially, because where it's positioned, I guess it's hard by earthquakes and also hurricanes. And with climate change,
Yeah.
it is going to be quite interesting to see how the resiliency of the Caribbean. Because I know even now in Trinidad, it's raining and like it's just flooding everywhere. Just everywhere, it's just flooding. Um, but anyway, I digress as well. So earlier on, you were saying, I think for the campus coordinator position, you were talking to the director in Haiti, and you would, or someone saying you wanted to do more when you got your master's, or if you had a master's level degree.
Yep.
So did you know that you wanted to get a master's degree when you were in your bachelor's program?
I had a lot of different options, or was thinking about a lot of different options. So when I was in my bachelor's program, I weighed the option of going directly into the workforce. I weighed the option of going to physician assistant school. Um, Still kind of had just going to med school on the table. Wasn't sure, but at that time was still like, maybe I could, maybe not. And then also was specifically exploring Caribbean medical schools at the time, because I was just realistic with myself, that I would have a better shot at Caribbean medical schools. Um, and then also exploring master's program. So I wasn't sure exactly what direction I would go into, but also um, my family, my parents would always tell me that a bachelor's degree was the minimum that I could have. So I knew that higher education was in the cards in some way. I just still wasn't sure what exactly that would be.
Okay. And then what persuaded you to go Masters of Public Health? And you got your Masters of Public Health at the Miami Leonard M. Miller School of Medicine.
Yeah. So honestly, after undergrad, I started looking at what kind of jobs were out there for someone with a bachelor's in public health. And they just weren't making enough money for me. So I was like, okay, maybe it makes sense to go back and get a master's. But I will say, just like from my experience, really try to ensure that you're paying the least amount of money as possible for your master's, because I was having this conversation with one of my friends today. I think, thinking about the pay difference from if I started as a bachelor's student in public health, or a person with a bachelor's in public health versus a master's, the pay isn't like drastically different when you compare it to how much debt I accrued from my master's program. Was 1 year because I did it accelerated, and I took a couple graduate level courses while I was in undergrad. So I had already, ticked off some boxes once I got to grad school. But I think if I had to, not that I regret anything, I think, going to University of Miami exposed me to public health in a different way because of the population, large Latinx, Caribbean population in general. And it's Miami, so it was beautiful. But I think if I had to go back, I would more actively look for ways to go to school for free, or would have potentially entertained the idea of going to a state school again for my graduate program.
Okay, well, thank you for sharing that. And I definitely agree that it isn't something that people like the investment in a Masters of Public Health or Masters just in general isn't something that you should take lightly. And I'm glad that you actually like, I guess looking back on it now, you analyze like the difference in it and to see if it really was worth it. You said that you got some of your courses, you got into an accelerated program as well as having some graduate level courses while you were in undergrad. So was that easy to transfer over? And then how was the accelerated program like for you?
Yeah, I think it was easy to transfer over. I don't really remember, any significant complications with that. It was really just a matter of, my sending over my transcripts, and seeing how they would convert to the requirements that were needed for my master's. And then doing it accelerated, honestly, I don't really feel like it was overwhelming. I didn't work. I just did school full time for a year. And I think because of that balance of, not really having to focus on paying bills via a job, really, really helped me in that way. So I don't feel like my program was more overwhelming because I did it in a year. But I think, I have to identify the privileges and how fortunate enough I was to only really have to focus on school.
Yeah, um, fair enough. So did you have a concentration? And then did you want to share any takeaways that you learned throughout your MPH?
So I actually did not have a concentration. So University of Miami, I was the second cohort to go through the program. So definitely fairly new program. And there were kind of tracks that you could take if you had wanted to. But I was really just interested in taking what I wanted to take, regardless of, where it fell and what track it was on. So no, I didn't have any sort of focus. I just, anything that had to do with like community health, global health, child and adolescent health, like those were kind of the classes that I was taking. And then obviously like the required biostats, epi, uh, research methods, things like that.
Okay, awesome. Were there any takeaways that you wanted to share beyond everything that you shared already?
I think, just thinking again, reflecting on, some things that I wish I had done. I think I wish I had, tried to strengthen some of the relationships that I made with my fellow students and professors. Cause I think I was kind of like, well, I'm grown, I have friends. Let me just go to class, do my thing, and then leave. And I did leave my program with a couple people that I can still lean on. I call them my sisters in public health, but I wish I made more of an effort, especially because my program, University of Miami has an MD MPH program, and I did have a lot of exposure to like a lot of physicians that were international. And I think it just would have been, a richer experience and more interesting experience to have, still maintain connections with, providers from India and the Middle East and, just Europe, all over the world, as well as professors too, because I think like my I don't remember her title, but I'm still really cool with like the career access person because I was talking to her all the time about because I was always thinking about like not very present, but always thinking about the next step. So like, all right, I'm in grad school. Like, let me make sure I can get a job once I leave. So shout out to Megan Garber. She's amazing. She's still at Miller School of Medicine. So I became really close with her. And then thereafter, whenever there were, different grad school fairs and stuff in my area, I would go and represent and things like that. But, I wish I maintained closer connections with the professors. And then also because of just getting references. So whether like I chose the job route after, but like thinking about, references for my jobs and then I might get into it a little bit more, but I did think I was very close to applying for Caribbean Medical School. So just thinking about the recommendations for that and stuff. So yeah, I would say just I wish I wish I put more effort into relationship building during my
Okay.
year there.
Okay. Well, thank you for sharing that. That's good insights and something for people who might still be in school to ponder and think about and really think through. Um, so your job afterwards, you did get a job. So shout out to Megan as a program coordinator at Boston Public Health Commission. So you moved back to Massachusetts, and you said that you were also thinking about still going to Caribbean Medical School. So what was the deciding factor on going the job route?
Yeah, so I don't know if I remember like an actual deciding factor. Because I was at the commission, really great experience. I think in that first role, I was like, whoa, I did not learn anything in school. Like the school did not teach me how to make strategic plans and work plans and put together budgets and meeting agendas and all these things. And again, that's where being a part of the student organization, that's like I feel like I used a lot of those skills rather than what I learned in school. But um, I don't know if there was like a defining moment. I do remember starting the application for um, a school in I believe I think it was Saba. I don't remember, but I do remember starting an application and putting together my personal statement and starting to get recommendation letters. But for whatever reason, maybe it just didn't feel right. Maybe it just felt forced. Oh, I think it was probably having to retake organic chemistry. I think that's what it was. It was just, and then studying for the MCAT, where I was like, I don't know. And that's when I stopped.
Yeah, I definitely know that feel, both with organic chemistry and having to study for the MCAT. So I definitely understand those struggles there and the thought process behind all of that as well. So what did you do in your role as a program coordinator? You said it was a lot of like administrative type stuff.
Yeah, it was definitely a lot of administrative. So essentially, it was a program that focused on hypertension, asthma, and elderly falls within the state of Massachusetts. And what we were trying to do was create bi-directional workflows where we would connect health centers and community-based organizations that supported with those things, as well as connected for the asthma piece, those health centers to Boston Public Schools. It was interesting. I think, in theory, bi-directional workflow, you're going into a system, you're communicating, you're sending information back and forth. Sounds good in practice. It was really hard to adopt. And then a huge part of the program too was like chronic disease self-management classes, supports for hypertension, home visits for the elderly falls piece. And one of the things that I really appreciate about that was where I really learned about like the community health worker model and fell in love with just community health workers in general and that profession, and was really a part of coordinating our core group of community health workers to be able to support all these interventions. So yeah, it was a lot of administrative, but also was able to be creative and share, my ideas and thoughts and be a leader, although a coordinator, but still be a leader in my own right. And I think, at the time, I feel like I downplayed my contribution to that, but my supervisor from that point in time, we still connect and we still talk, and every once in a while there's a little tidbit that she remembers about what I did in the job, or what I did as a person in that role, and I'm like, oh wow, I made a greater impact than I thought I did.
Yeah, well, I'm glad that made a great impact and greater one than you thought you did as well. You got your community health educator certificate while you were here. So what tell me about that? What was that about?
Yeah, so I think being someone that has been fortunate enough to, be a part of academia and like get, my master's, my bachelor's, like very much on the path that is seen as, traditional or what have you. I kind of skipped over community health worker work, even though you could kind of say some of the things that I've done in like my internships and my positions during undergrad were community health work. Um, but because I was like really organizing this cohort of community health workers in my job, my supervisor felt like it made sense for me to go through the actual certification process and that coursework so that I could better, identify with the people that I was leading, at such a young age. So went through that, and I think Massachusetts is definitely a pioneer in the certification process for community health workers. And actually learned within that, I think it was about 2 to 3 month program. Really learned a lot about organizing, about communicating with people, about connecting people to resources. There was even a little section on overall public health as well. That was very interesting, and was really honored to be a part of that program and process.
Yeah, that's awesome. That definitely is awesome. I feel like community health workers don't get the credit that they need a lot of the times. And I know that they're getting certifications and different like associations in different states and then building up models. I know that the North Carolina Community Health Worker Association only like recently started, I think this year or last year, which is crazy to think about, but look forward to seeing the work that they do because I think it is very pivotal. And I just wanted to highlight also that you said that you picked up on the skills from community organization, I mean like student organizations. So like building out meetings and agendas and things, because that's something that I picked up a lot being the president of the Public Health Student Association that I didn't have before. And as well as I'd say, it's not something that you traditionally get from classes. So I just wanted to touch back on that as well. And then
Yeah, and just to say, it's such a huge part too of like our work culture. Like I feel like I'm always, even now, like always creating agendas and facilitating and running meetings or participating in meetings. Like, so yeah, I think it's really interesting that we don't even really brush upon that within the scope of school, but I think that's where we think about how education and experience meet, and I think that's one of those things, and that's why experience is super valuable.
absolutely agree with that. So thank you for adding that in. And after this role, you were a health educator at Harlem's Children's Zone. So
Mhm.
so is this in Harlem in New York?
Yeah,
Oh,
Harlem.
okay, so how do you come across this role? Why do you move, and then what do you do in it?
Yeah, so I'm a woman with many lives. So I did music in my past life, and thought I was gonna be like the next Lauryn Hill. So took a chance, was young, and was like, let me move to New York. But while I'm in New York, I need a job. So, I applied to Harlem Children's Zone and actually heard about Harlem Children's Zone from folks working at the in the asthma office at the Boston Public Health Commission, and it's actually very well known, very much a pioneer with their asthma work, and found the position. I think I was originally applying for I think it was like a manager or coordinator position, and didn't get that, but then they suggested that I applied for the educator position, applied, and then I got that. And as a part of that role, I worked with families and students in an after school program to educate them on nutrition, and would work with the nutrition educator to make healthy meals for them, introduce them to different types of fruits and vegetables, as well as do like different physical fitness activities with them. um, and then there were certain just things that we would have to track. So their endurance, we often tracked their BMI as well, and then would have just check-ins with the students on just how they're doing, what's going on, what have you been eating, how's school, have you been exercising, and then create kind of like a care plan or a goal plan that was very specific to each student, and work with them to achieve their health goals.
Okay, that's awesome. And I'm glad that you mentioned that, like, you applied for this one job and you didn't get it, but they referred you to another job that you did get. So just in case people are looking for jobs, you never know if they're going to put you in contact with another role that's coming up, or they see you as a better fit in another role. And then I'm definitely not going to just roll over you saying that you wanted to have this life as the next Lauryn Hill, Beyonce from Haiti. So tell me a little bit about that. So you were working this health educator job and then trying to get into, well, I'm guessing singing.
No, I actually rapped.
Oh, okay. Did you? So tell me how did that all go?
Yeah, so, from Massachusetts, Boston, had a lot of connections, had a lot of hype around what I was doing. And I was like, let me go to the big leagues. Let me go to New York and see, if I can make it there, see what it's all about. And, my position at the time was part-time. So I would go do my thing. It was after school program. So from around like 3 to maybe 3 to 7, I would be working, 3 to 8. And then, during the day, I was either, in the studio, I was writing, I was going to network events, and, just trying to make my dreams come true.
That's
Yeah.
awesome. That's awesome. Do you still have any dreams of becoming a rapper?
No, not at all. Like, I don't even recognize that part of myself. No.
No, don't say that. Don't say that. Don't let it die. Don't let it die. It can still happen. You never know.
No, I don't think so. But I will say that I started off as a spoken word artist. So that's what I did literally all throughout. I've been writing poetry my whole life, and then started performing my poetry in high school, did it constantly in college and actually got really good at it. And then kind of thought like, hey, like, maybe I should translate this into music, and then tried it. It was a great experience that a lot of amazing people, people that I still communicate with to this day, got awesome opportunities to perform, not just within the country, but internationally. But, did it, tried it, on to the next.
Okay, we're internationally.
I performed in Rio, Brazil.
Okay, that's dope. That's dope. And if you still do have any interest or you're keen in any way, I definitely think I'm thinking about bringing together like public health people to do some sort of poetry thing. So I will loop you back in that if you have interest in that.
Oh yeah, definitely.
Okay, awesome. Well, thank you for sharing that part of your JD as well. That's awesome to hear. And I always love to hear like people's tangential public health journeys, like whatever, because life is not just what you do in school and everything that
Right.
like we say in this podcast. So awesome. So then after your health educator role, you became a community health and wellness program manager at Brockton Neighborhood Health Center. Was this a full-time position, first of all?
Yeah, so this was a full-time position. This was me realizing that, maybe I don't want to live in New York anymore. Moved back home, and luckily the city that I grew up in, that was actually the health center within that city. So I applied for that job, and literally next day, I think got a call for an interview. And then within a couple days, I drove from New York to Massachusetts to interview. And then the day after my interview, got the call that I got the job.
Okay, that's awesome. That's awesome to hear. I'm sorry that you gave up on the dream, though. Like it breaks my heart a little bit inside. So what did you do in this job?
So I was doing actually really similar work to what I was doing in Harlem without the specificity of like working with children and their families. And it was more so like our whole health center population, as well as, working with our health center staff on just different resources that we could provide that were in the community and as well as in-house. So like for example, put together a market called the $1 bag market, and partnered with an organization called Fair Foods. And every week at the health center, they would bring a truck filled with produce, fill up these plastic bags and then sell them to the community as well as health center staff for $1. Partnered with a college and did very similar work where we gave our patients kind of coupons to be able to buy produce from student or from the college, which also had a farm that they would bring those once a week to the health center. Also worked on a program that went into the senior housing sites within that city, low income senior housing sites, and put together classes on like diabetes education, healthy eating, organized that. Also supervised a few community health workers as well that were integrated in some of these programs. And then also pushed the like racial justice focus in a lot of the work that we did. Also, would bring in instructors from the YMCA to be able to integrate fitness into the health center as well as like the senior housing sites that we were in. Sat on a lot of different like citywide coalitions, committees, groups to be able to represent the health center as well, in which we put together events around the city and things like that. So that was an interesting position because it was a part-time position when I came on. Like I wasn't working part-time, but the person who was in the role before was working it part-time. But they gave me the offer with a full-time position. So in the beginning, it started off slow and I literally had to like create things and add things to my plate to make it a full-time position. And I got to get like really creative in that role. So that was exciting.
Okay, that's awesome. And during, I guess, the negotiation process, was that part of the talking points that they gave you, that it was a part-time position, but you're going to come into a full-time position and you're going to be able to kind of create what you need of this position?
It wasn't really a part of the negotiation process. I don't think I even realized it was before me coming on. It was a part-time position until like I got there. And it was and the reason they made it a full-time because it was under the expectation that I would support in applying for grants and applying, just to create more health and wellness opportunities within the health center. So they knew it was going to grow, whether it was me or somebody else. So.
Okay, and then you also spoke about having to manage community health workers, both in this position and in a previous one. So tell me, what have you seen as the benefit to having community health workers on your team?
I think community health workers are amazing because they're literally the bridge. They have an insight to the community, like in a way that a lot of people don't. I think especially there are a lot of folks that I feel like are within like the public health system that are very much removed from actual community, but then have a say in how it is that we use the money, how we create programming and things like that. And the benefit was like before I made decisions about these things, I would say like, hey, what are the people like in the senior housing sites, like what do they actually want? Because I didn't have the time to go in and survey them and talk to them. And, once in a while I would pop in, I would go at the farmer's market, check, see how it's going, whatever. But they're the ones that are like boots on the ground, talking to patients, members, whatever you want to call it, every day. So I feel like that insight is very crucial, and like the relationships that they're able to build by doing that are very crucial. Like when I would go to like senior housing sites with my community health workers, like if you could see how the residents would just flock to them, and like it wouldn't even be for like diabetes or medication management. It'd be like, well, I got this in the mail, this is from my I don't know, like my cable provider or something, and can you help me like figure out how I pay this bill? And they would just be like, they would be kind of like the support for everything. In seeing that in action, you really start to identify how important they become to a lot of people, and how it actually goes beyond what people think a community health worker does.
Okay, awesome. Well, thank you for highlighting that, because I do think they are very important, and especially they can be they're not utilized to the best of their abilities yet,
Mhm.
in a lot of different ways. And I think that there's a lot of value in community health workers. So thank you for sharing that.
No
And
problem.
then, yeah, of course. And then you were Act So mentor at the NAACP. So how do you get involved in the NAACP? And then what do you do as an Act So mentor?
Yeah, so I got involved in the NAACP when I was in high school, actually. So I was a part of the AXO program. And
Mhm.
essentially, the AXO program is a national program that works with high school aged youth. And you can have a focus that's like pretty much anything. There's folks that focus on like oratory skills, so like making speeches. There are folks that focus on science, art, dance. There's different focuses that you can have, but I naturally focus on poetry and competed locally, won locally within my city, and then was able to go to national competition. And at that time, it was in New York City, and it was literally one of the most amazing experiences of my teenage years because it was this huge hotel filled with young Black kids from all over the country. And we met so many people that, might not be in contact with today, but I follow them on social media. So I like see what they're doing. They see what I'm doing. We encourage each other. But it was just so beautiful to see all these talented Black people in the middle of like Times Square all together. And, we were young, so it was like, oh yeah, we don't have parents here. Woo! So it was like, oh, okay, this is what college is gonna be like. So it was like that taste to it. And what I do now is for students that are doing the poetry aspect and competing in that, I prepare them to compete locally, like as a coach, mentor, and then also prepare them to compete nationally if they're able to make it to the national competition.
Okay. Why was it important for you to get back involved with the NAACP?
It was important because it was such a like pivotal part of just me being young. Like it was just such an amazing it was an amazing experience, and I don't know how to describe it other than amazing. And I just wanted other people, young people, to experience what I experienced at the national level because it was just so beautiful to be a part of.
Okay, awesome. Well, we appreciate that. Um, and then after this, so I'm guessing like during your role as a community health and wellness program manager, you started you are the founder and the executive director of What's on Your Mind Incorporated, where you are combating the stigma of mental health illness in communities of color by engaging in conversations around thoughts, emotions, and feelings. So tell me about the thought process for starting this.
Yeah, so that actually happened after I had left my job at the Boston Public Health Commission and before I got my job, Harlem Children's Zone. Honestly, advice for people within, just your career journey, don't quit a job until you have another one. But I was in between jobs and, literally was just thinking, oh, actually, no, this is what happened. So I was on my way to interview or not interview, I had gotten the Harlem Children's Zone job. And I went to go drop off like my paperwork and I was in Harlem. And, I think I was super hyper aware of everybody else because I was so happy that I got a job and it was like, okay, I'm like making moves to living in New York and becoming a superstar. So I was like super happy and I saw that everybody else was like in distress and, looked like they had a lot that was going on in their minds. So I was like, maybe one day I'm going to come out here with the sign that says, what's on your mind? And then I did that. And then it really just spiraled into something even greater than I had thought it would be. And I really became within Harlem as well as Roxbury and Boston, really became a resource and an outlet for people to really just, talk, have a conversation, vent, have someone listen to them. And that's what started it, got a board along the way. People really gravitated towards what I wanted to do, wanted to support, and became a 501c3.
Okay, so how long did it take for you to become a 501c3?
So I started my actual outreach in 2016. Got incorporated in 2017, and then became a 501c3 in 2019.
Okay, and were you still doing work throughout this entire process from 2016 to 2019?
Was I doing what? I'm sorry.
Like just like work around what's on your mind, or yeah?
Yeah. Yeah.
And during that time, was it just that you were still just going out there with a sign and being a resource for people, or what transpired during those 3 years?
Yeah, so during like the 3 years, it was really very much so like direct outreach, talking to people, having dialogue. And then I think in 2018, we started a podcast because we wanted to take the conversations that were happening on the street and elevate them to a platform where people could hear them and talk about some of the consistent topics that would come up in those street conversations. We, put together a mental health festival that we were having every year prior to COVID, and would invite guest speakers and work through therapeutic modalities, exercise, talk through nutrition, art therapy, massages, facials, like all that. Um, and then we would do workshops with different organizations. Well, we still do workshops with different organizations. We have a website with tons of resources. We keep a therapist of color list on our website for the state of Massachusetts. And yeah, it just really grew from having those conversations and then people being like, oh, can I have your number? Can I continue the conversation? Or, I need help with housing, or my son has an IEP and I don't really understand what that means. So we just try to expand in the way that makes sense. We also host listening sessions. So now that in the time of COVID, we're not going out as much as we used to, just to protect us and the community. So we have a way that people can book a session and speak to one of our active listeners that are trained in active listening. So yeah.
Okay, awesome. And what's the name of the podcast?
It's called The Mindful Podcast, MIND space FULL.
Okay, awesome. I'll definitely be sure to link that in the show notes. And then you said it was we. So when did it go from you going out there with a sign to becoming a we?
Yeah, so I think once I started, it was very much by myself, but then people would hit me up, hey, can I go with you? And I would post on social media, like, I'm going to be at 125th and Lenox at this time, like, come say hi. Or, after I got off of work at Harlem Children's Zone, would walk with like a colleague, and then we'd go to do the signs. So, definitely had friends support me over time. And then I think maybe in 2017 or early 2018, I felt I was ready to like take the organization to the next level. So thought about the people who had over time been like, this is like, we're really thoughtful about being like, this is really amazing what you're doing. If there's anything I can do to support you, I am a graphic artist, or I am a licensed social worker, or I am just, an advocate for mental health and I'm really passionate about it. Like, please let me know how I can help you. So I like pulled all those people together and we're like, everybody come meet each other. Let's see what we can do. And, those people have shifted and changed over the years. Cause again, that was 2017. But some of those people that I originally reached out to are still a part of that core group. And we are expanding, or have expanded this year. So yeah, we're really excited.
Okay. And tell me about that expansion this year. So when we say this year, 2021, correct?
Yeah, 2021.
Yeah.
So it's been, when I say like there's people who have been around since I like made that first initial group. It's two women, Ariel Gray, amazing writer for WBUR, which is Boston's NPR network. And she is just a music aficionado. She is a culture writer, blogger for WBUR, amazing graphic artist. And then she also has bipolar disorder. And then Dominique Joseph, who recently got married. I don't know how to say her new last name, but she is she has a master's in social work, and she is great at social media strategy and is supporting the organization in that way. And then this year, because our team shrunk, because people have lives, people have other priorities, things change. So it was this three of us, and recently have recruited two other people in the social work field. One is, I think, a licensed mental health counselor. One is a licensed clinical social worker. We also have two lawyers on the team now. And am I forgetting it? And we have someone who's like a business strategist. Actually worked with him at my current position. Two people I actually used to work with at my current position. And he, was the chief of staff at my job and currently is working with a healthcare vendor. And, he's helping support us with our business strategy. So that's the team. We did have a grant writer, and unfortunately, her priorities shifted. So if there are any grant writers out there, please hit me up.
Will do. I'll definitely make sure if I do know anyone, I will point them in your direction. So tell me a little bit about how the business strategy has changed. So it went from you going on the street to you like creating, like you said, like social media posts where people can come and see that you're going to be here, and then you're helping people with different needs that they had just generally. And then now you say you have three people plus the other auxiliary lawyers, etc. So and so tell me how that has evolved, and like how you've thought about this business developing from 2016 to now.
Yeah, I think it's definitely a slower burn than I initially thought it was going to be. I always thought about like my dream being adopting the mobile model, walking around doing a mobile version of what it is that we are doing now. And that has definitely, again, been a slow process to be able to acquire the funding to do that. I think a huge part of nonprofits and running them and sustaining them is funding. And I think there's definitely a barrier to entry, because oftentimes they want to show that you have history of, being able to use large amounts of money. But like, it's like, if you're new, how do you show a history of being able to use X amount of money? So, just was stuck in kind of this in between for a long time, still really stuck in it. So I think, if I'm being like super transparent, at a point where we're thinking about like how much effort goes into this, like what do we want out of this? And I think the business strategist has also allowed me to think of like really becoming good and being staple at one thing versus like trying to do so many different things. And I think public health people in general, we have a tendency to be like that. And that maybe that's why we choose public health, because it is so broad. But yeah, I think really thinking about tailoring the work that we do. So, because everybody has like a full-time job. Again, like people are seeing patients, people are writing for big national news programs, people are working at big healthcare companies. So really figuring out, like, I think we're still in the midst of like, where do we want to go? How much money do we need to get there? And what is actually practical with the time that we have? So yeah, I know that's like didn't land anywhere, but it's definitely just a work in progress. And really, as like a founder, just thinking about would somebody else in my position be able to run the organization better than me? Is just something that I've been thinking about as well. Because during the pandemic, I started another business, and even within the last 8 months of my business have seen just financially and just in terms of like word of mouth such tremendous growth, that I'm thinking about how do I scale that. And it's, again, don't want to put to do too much and spread myself thin, and thinking about what the priorities are.
Okay, that makes sense. And I appreciate you sharing that because I know a lot of people in public health that might be thinking, oh, I want to start this nonprofit and do this. But
Mhm.
that I like the reality of it is that there are a lot of barriers and a lot of things that you have to overcome, and you need dedicated staff and people to do well, not even, it doesn't have to be staff, volunteers to do a lot of the important work to really grow and scale. So really think through what you want to do, because it oftentimes isn't as easy as it does seem to be. But that's not to discourage you as well. We need a lot of people doing different work.
Yeah, and I would say, like, try to figure out what exists already. If what you're doing exists already, there's really no point in creating another entity for you to kind of just put to the wayside after a few years. So again, not to discourage, but just like be realistic.
Yeah, absolutely. And it seems like you're definitely someone who's very visionary, trying to do a lot of things. And I guess I say that to say that you're saying that the business strategist has really helped you to know what you're good at and do that, and then probably like hand off what the other things are to other people who are better at doing those things. And that's a hard reality. We do have to face that. Our time is probably spent better doing the things that we're really good at, and the things that we're okay or maybe even good at, we hand it off to someone else that is really good at it, and really leveraging other people than rather just doing it all ourselves. And I don't know if you wanted to talk about the other business. I don't know if it's public health related. I don't know what kind of business it is. If you wanted to talk about it, I'll give you some space to talk about it as well.
Yeah, yeah. So I do consulting around health equity, specifically through a racial justice lens. So I work with different organizations, health centers on trainings, workshops, do public speaking, as well as coaching on how to make sure that you are supporting the staff within your workplace, from a health equity lens, as well as thinking about your patient population and how you're meeting the needs of everyone and supporting everyone.
Okay, and what is the name of that business?
It's it's just, I don't know if it's really, well, actually I lied. I did my sole proprietorship earlier this week, and my DBA, doing business as, is driving equity consulting.
Try that
But
equity consulting.
yeah.
Okay, awesome. And if you have any information that you want me to share in the show notes about that, just let me know. And then I would also share it in the show notes, and people can check that out as well. So actually tell me why do you decide to start this business? What was the driving factor there?
So I've always looked at my public health practice through a racial justice lens, and has been, a huge part of my work since I started. Um, Even if I really think about it, even in grad school and undergrad as well. But given the events that happened in summer 2020, I really felt like I wanted to not just do this kind of work within the scope of my like actual position in my 9 to 5, but felt like a lot of other organizations needed support. And it really started because was asked by a friend of mine to just do a lecture on racism in healthcare, and from there started doing that presentation like within my organizations to some other community partners that I work with in my job, and got a lot of really really positive feedback on those presentations. And then I just started charging for them, and then like it grew.
Solid. I like that too, because it's kind of like you're testing it and you're seeing that people have interest in it, and then going from there and monetizing it from that side. So
Yep.
so you have this nonprofit, now you have this for-profit consultancy. Tell me what have you learned from this, from both of these?
I've learned I feel like there's a lot of things. I've learned that like one, you can even though I was saying like you gotta focus on one thing, but I think if you are strategic and you build systems and have like the right people on board, you're able to do a lot. So with like my with my consulting, I realized that what I appreciate more is not necessarily the coaching, because the coaching requires a lot of time. It's a lot of like going through logistics, and although it's fulfilling, but it almost feels like there's a sense of release of control too, because you're talking to the organization about what they need to do, but you're not boots on the ground in the organization to be able to make the changes. So that's a little bit of frustrating. But like from monetization perspective, and I think it's just like also like I love teaching, I love educating. So, but like my trainings, my workshops, that's where I feel most inspired, and that's where I can literally take the same training, make some tweaks to it, tailor it based on the audience a little bit, and then it's like it continues to just like be something that doesn't require a huge lift to go and present. And then like after an hour and a half, I'm done, and then I get my check, so I think that that's one thing that I've learned is like, I guess like what works for me as a part of that aspect. And then just like what are the needs of certain organizations, through having dialogue with them, conducting surveys, and have been like also in a place, like not to get too like dreary, but have been in a place where I'm realizing like how much of a difference can I actually make when we think about inequities and we think about how people are interfacing with so many racist systems. It's like, even if I coach the organization to be as anti-racist as possible, like the people that are within going or that are working within their organizations and also going to seek support from their organizations are interacting with the school system, they're interacting with the HR at their own job. Like I don't know if that's something I've learned, but I mean, it's like a part of the experience and a lot of the thought process that I'm thinking. And then, I think with what's on your mind, I think it's constantly a challenge of my leadership and how to become a better leader. And how do I, especially when you have a vision in mind and it's your passion project, how do you get people to support that and work for free, like you said, volunteer to make that vision happen? So I think I've become a way more effective leader specifically because of that.
Okay, awesome. Well, thank you so much for sharing those. I think those are great insights. Like on my mind is consultancy insight that you shared. Like people thinking about wanting to do like a resume business or whatever consultancy, like one-on-one coaching. It is fulfilling, but it does take a lot of time and it's a heavy lift compared to having this product that you just go and produce and you. It's easy to just continue to multiply that and share that, and just thinking about, because I was also having this conversation with someone about like working in your business versus working on your business. And when you do get tied down with all those minuscule tasks, it does turn into you just working in your business and there's no way to grow it. So there's a lot of different great insights that you share there. So thank you for that. And then in your other, well, I guess in your other role, you're a community partners and health equity program manager at the Steward Health Care Network. And you said earlier that this was an international health system, correct?
Yeah.
Okay, so tell me a little bit what that means.
Yeah, so we have hospitals all across the country. We actually acquired 5 new ones as of last week in South Florida. And then what makes this international is we have a hospital in Malta. And then, we're buying up hospitals right and left in the state of Massachusetts, Utah, Arizona, Texas, everywhere. So I work for the specific network, and within that network, I am working on our specific Massachusetts Medicaid population. So I manage programs within like that sphere. So one of the programs that I manage is the Community Partners Program, and essentially that connects organizations that are within the community to our practices so that there's an integration of behavioral health services, social determinants of health services with the provider, and they're like on the same page about their patients and what kinds of additional supports that the patients need outside of medical and outside of just going to their PCP. So that's the Community Partners Program. And there's like, it's a very complicated program. There's literally so much to it, but that's like the very like 101 explanation. And then the other side of my wheelhouse is health equity programs. So, again, since summer 2020, our company has been very focused on health equity. So that entails improvement in data collection on demographic data. That includes organizing trainings company-wide. So for all 44,000 of our employees nationally, that includes sitting on different committees, work groups to be sure that we're looking at things through a racial justice lens.
Okay, and how did you come across this role?
I think just on Indeed, I was looking and I found it and I applied and then I got the job. And then 3 months after I got the job, COVID hit. So it was definitely very interesting transition to still be new. Because again, not even just my position and the programs that I work on are complicated, but the entire system was definitely a culture shift because I was working all in like nonprofits before. To shift from the nonprofit culture to the for-profit was very, very different for me, like very, very different. And I was very intimidated by it. So that was interesting, but now a year and a half or a year and some change, almost 2 years in this position, I feel a lot more comfortable and I know what's going on.
Okay, and how did you get yourself to feel more comfortable in the role?
Working from home for me, I know that like people have different opinions on work from home life, but I think working from home has definitely helped me tremendously because after meetings you can like step away, take a breather. If you feel the type of way about what someone says, you're not on camera, and like I'm the type of person you can read everything on my face, so like that's definitely a benefit. I think the work-life balance because I'm working from home is definitely a lot better. And then I think it's really just time. It's time. I think, and within public health, there are so many different acronyms. And then once you get to like a new company, there are new acronyms that you have to learn. And I think just like repetition and people saying them over and over again, or like talking about the systems over and over again, you just start to pick things up naturally. And then before you know it, you're talking like everybody else at the company. So it's just, I think just learning the culture and being patient with myself. I think you posted like not too long ago, like a posting like, to be okay with not having anything to contribute to in meetings. And that's something like I always struggle with when I start a new job, especially this job, because like, especially in person, because like when you're on the phone and you're muted, I guess it's not as awkward, but like, and especially if your camera's off, it's not as awkward. But like when you're in like a conference room and like everyone's just like so engaged in the conversation and you literally can't keep up, you don't have anything to say, or you don't want to just like, some people will reiterate what people say, but I'm not that person. I'm not going to waste time. I'm not going to waste my breath or people's energy just saying what somebody else said just so I can speak. And it just feels like really uncomfortable. But yeah, I think just like sitting in that discomfort long enough until it started to become like natural to me. And there's still times where I still don't know what's going on. because Medicaid in general is very complicated.
Yes.
Medicaid is just so complicated for no reason. It's a lot. So, just being okay and like just thinking about everyone as a teacher in some way, especially in leadership positions. So,
okay. Well, thank you for sharing that. It's good advice. Definitely, it is hard to adjust to a new work environment, new work culture, and I'm glad that you are making yourself at home, literally at home. So, so yeah. Where would you like to see yourself in the future?
I would like to see myself like just doing what I'm currently doing, but like at greater scale. Or no, not even. I think I want to be someone that works when I want to work. And not have to work because I have to work. And I really see myself being a philanthropist because I think it's Frieden's impact pyramid and how like where we want to create the most change. It's like a pyramid and it shows like where we want to create the most change. And the way to create the most change is by making changes in socioeconomic factors and also the environment in which people make decisions. And I think by like being someone that's in charge of who gets money, where the money goes, and how it's given, I think would have so much greater impact than like what I'm doing right now. And my role is like managing, and not to say like I don't have impact, but I think, again, working in Medicaid, it's prescriptive. There's a lot of red tape. Managing grants already in general, because yes, when you apply for the grant, you are pitching some sort of program, but it's still within the confinement of what the grantor is really looking for and asking for. So it's not like, I talk to, my colleagues about like creating grants where we're giving community members money to start businesses that impact health of the community. And then we're actually funding them to do something that's going to have greater service. But it's like, what grant out, who's going to give me money to do that? Like, who's going to give me money to directly give to residents, and help them think about business strategy and finance and coach them through, we live in a capitalist society. So like, let's teach poor people about capitalism. Let's teach the Medicaid population about capitalism and how they can thrive in it, because that's where we are right now. But like, who's gonna give me money to go do that? No one's gonna do that. So I want to be in control of the money for people to be able to go do things like that. So that's where I see myself. And working smarter, not harder. I think I've worked a lot throughout my life. I know I'm still young. I'm young. But I just don't think life was meant for us to just be working all the time. Especially I think being the overachiever that I have been and just accomplishing all that I have accomplished, I think there is so much value in rest. And I think, rest for Black people in particular, is a revolutionary act. And I think if I can create a life where I can rest and reflect and admire beauty and nature and travel while still making an impact, where again, in socioeconomic status where it really matters for people, that would be like the ideal life.
Awesome. You're talking my language right there, for pretty much everything you just said. So I definitely resonate with a lot of what you just said. So I look forward to seeing you become the philanthropist and do that work. And yeah, I think it's so important that everyone understands capitalism and how they can benefit from it, because it's not going away. And
Exactly.
as we see, the rich are getting richer, so the poor need to figure out how to tap into the system to really get the benefits that everyone has been before. And I think, like, to your point of what you're trying to say is like you're definitely trying to get a system change, as well as like just making sure that populations at a general level are able to have access to this, whether it's knowledge or education or whatever the case might be, to have the best health and life that they can have. And I look forward to you getting those rest days as well. Shout out to that rest.
Thank you.
Yeah, of course, of course. And then moving on to the last section, the show, the Furious Five, 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I think the advice that I'd give is reflective of what I said earlier. Just network, meet as many people as you can during, undergrad, grad school, internships, um, even like the patients or the members that you're serving. I think you can learn from anybody and everyone, and whether they become like some sort of connection that offers you a job or whatever. I think you'll continue to take pieces of that person on with you throughout your life. So
Some great advice. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
yeah, so I think in terms of the consulting, just start, because I think with consulting, it's literally your knowledge. Um, I my dad came in and he probably, I don't know, printed out like my sole proprietorship papers or something like that. He's my accountant. But I just started and I was filling out W-2s with just like my social, and then, the plan was, once you start making money, then we can fill out the appropriate, tax forms to be able to get it identified as, your company. You are the company. So, just start, because again, it's the PowerPoint, it's the resources. So just get started. I think in terms of my role at Steward Health Care Network, I think bomb interviews, like practice your interview style, practice, being able to connect with people. I think like one of my tips and tricks when I'm in interviews, or just like even just when there's like awkward silence at the beginning of meetings, ask people about their children. Like that is the cheat code. Like like unless someone has like a really strained relationship with their child, 98% of parents are going to get really happy if you ask about their child. And if you remember, like when someone goes on paternity, maternity leave, oh, like you're back already. How's so and so? How's the baby? Even if you don't know the baby's name, how's the baby? Like, how old is he or she now? Like, parents love that. They will eat it up. So do bring that into your interviews too. If you see a kid on the desk, bring that in. Um, and then always remember to like when you're applying to jobs, update your resume, because like my resume is like still the same format, but like over time when I read through it, I catch maybe different like grammatic errors, or like I'm just like, oh wow, I could have said this bullet point a different way. So continuously review that. And I think, a good resume and a good interview definitely got me the position that I'm in today. And then I think for like the nonprofit, I think if you truly believe in what it is that you're doing and you think it fits a need and a service, like, just also go for it.
Some great advice for all three of those. Thank you. And then number three, what's something you're working on, you're improving in your life right now?
I think I'm working on improving my emotional intelligence. So I think like academically, I'm strong, but I think a part of business, a part of, communicating in any type of relationship, I think it's important to, um, really think about your emotional intelligence. And, my friend always says like, play the game. And I think that's something that I constantly think about in my head is like, how do I play the game, in this work environment? How do I play the game with my partner? How do I play the game like in a way where, you know, um, I'm protecting people, I'm protecting myself, and I'm being strategic, not malicious, but like strategic, because like I think, for example, in my younger years, um, in workspaces where I felt like things weren't fair, or I was being treated differently, or I just like felt like someone played me in that space, I would always just like tell them how it is and be honest and like even write it in email. And like that's not, you don't want to act on emotion in that way, because it's like, especially if that person isn't paying you, that person isn't, you know, that that person was just in a committee that I was in. And like now I look back at it and I'm like, why did I do all that? But like, yeah, I think emotional intelligence and knowing how to interact with people, when to interact, and when to press play on your different emotions or pause on them is super important.
Okay, awesome advice. Number 4, professionally, do you recommend anything?
Professionally,
Mhm.
I think investing in like trainings, I think is super important, especially now with COVID. Like, go on Coursera, you will see all different kind of trainings and certifications for like everything, and a lot of them are free. So I've recently done like a DEI training. I've done health equity trainings put out by Johns Hopkins. So like, use this time, especially if we go into another lockdown, use that time to beef up your certificates, add more things to your resume. Like, I have friends who learned how to code in the last year, lots of different things. So definitely take advantage of all the offerings that are online right now.
Okay, awesome. And then last but not least, where can people connect with you?
You can connect with me on my website. So www.theresaalphonse.com. That's kind of the pathway into everything else. If you want to connect on the nonprofit side, you can go to www.WOYM, the acronym for What's on Your Mind, Inc.org. And then you can find me on all social media platforms as Theresa Alphonse, MPH.
Okay, awesome. Well, I'll definitely be sure to link all of those in the show notes if everyone wants to check you out and just see more about what you're doing and connect with you. But thank you so much for taking time to come on the show and sharing your story and sharing your insights and all the things that you're doing and continue to do. And I wish you nothing but the best going forward.
Thank you so much. I appreciate you for having me. This was great.
Yeah, my pleasure. And some housekeeping items. Thank you everyone for watching this or listening to this. Greatly appreciate it. Make sure that you subscribe, that you leave a like, that you leave a comment. If you can leave a review, I greatly appreciate that too. Share it with a friend. And if you want to support, you can go to buymeacoffee.com/PH Millennial. Thank you all.